with the Rhode Island State Health Laboratories. A couple of quick housekeeping items. Make sure that your volume is muted so we don't get any interference from other phones and computers. Also, feel free to add your questions in the question box in your panel or into the chat box, and we'll make sure we answer them toward the end of the workshop. Compliance is important. We all know that, but streamlining and managing your accreditations and audits can be tedious. Now more than ever, companies around the world are feeling the pressure of safety and compliance mandates. Compliance is no longer the sole responsibility of a quality department. These pressures are felt across several departments in your organization. So what do we do now? Nicole Duffy is here to help us. She has worked with the Rhode Island State Health Laboratories for almost 12 years, 4 years of that as a Quality Assurance Officer of the Environmental and Forensic Sections. Before becoming Quality Assurance Officer, Nicole worked in the environmental-led organic chemistry and toxicology laboratories at the Rhode Island State Health Laboratories. Before going to Rhode Island, Nicole worked for 5 years in private environmental laboratories. The views and the opinions expressed in this webinar are those of Nicole Duffy, the presenter, and not necessarily those of the Rhode Island Department of Health. Before we get started with Julianne and Nicole today, we're going to take a quick poll. We want to ask you, how do you manage your quality and compliance each day? We'll give everybody a few seconds to take the poll. Looks like we have some responses coming in. We'll give it a few more seconds just to see what everyone says. We have a lot of electronic files and folders coming in, and quite a few paper and filing cabinets too. Okay, great. I think we're going to close the poll for now, and I'll be sure to send out those results later so you can see what everyone else has. But we do have a lot of the paper and filing cabinets, electronic files and folders, and a few other SharePoint and other project management software in there too. Nicole and her labs use Qualtrics to manage their compliance. Now Julianne is going to tell us a little bit about the software that powers these labs. Julianne Poff serves Qualtrics in the role of Senior Global Sales Executive. She is responsible for helping the sales department both domestically and expanding Qualtrics internationally. Julianne serves on our internal auditing team and has been a document control administrator at a Fortune 500 manufacturing company. We're going to turn it over to Julianne now.
Thank you, Sarah. Qualtrics has been around for over 20 years, helping organizations in regulated industries manage their documents, processes, and training for their quality and regulatory compliance. Some examples of some of the agencies we've been able to serve in different laboratory spaces span across the globe, both on the local level, county level, state level, and federal levels as well. The main reasons organizations are looking for an electronic compliance management system is typically the result of a new compliance that is being mandated for that industry, or there have been findings during audits. The top 10 nonconformances as reported by ANAB that occur during audits are listed here. There is a definite theme within organizations having issues in 3 main areas. The first being document management, either keeping up with the most current version of their procedures, having incomplete procedures that do not contain all of the required elements to the standard, missing procedures, or using wrong versions of procedures. The second focus area is having issues with the management of their processes. One example is with organizations not being proactive in scheduling their internal audits. These may then not fully address all of the elements of their management system. Then the second part, of which is the biggest issue, dealt with the fact that if there were OFIs or nonconformances that came out of those internal audits, documenting, monitoring, and closing those actions in a timely manner is where organizations get tripped up. And thirdly, training and skills management. Organizations are not maintaining appropriate documentation to show training educational background, and competency testing. In addition, they do not have adequate training plans that cover the training required, education needed, and skills goals for those positions within their organization. I am sure part of the reason you are attending today is that your organization has a priority on quality, and with limited time, resources, and funding, you need a way to help you manage these efforts efficiently. That is where a system like Qualtrics can help. As we will see shortly from Nicole, Qualtrics has 3 core components that can help you address these items: document management, process management, and training management. All of these items are stored in one central system. You can control the access of who has permission to see and do what within the system. Everyone knows where to go to find their procedures, work instructions, information on processes they are managing, and their training records. All items are routed through email alerts and actions to remind people when tasks are coming due or are past their desired due date. This helps to improve efficiency, visibility, and consistency of everything that is occurring within your organization, reduce waste, risk, and inefficiencies, and helps to support that quality culture within your organization. With having everything stored and maintained in one central system, you can search and report on all of this information in a very timely and efficient manner. We are here to help you through this process and getting your system up and running by sharing best practices, installing implementation assistance, training, and then providing ongoing support and assistance throughout your life with Qualtrics. So with all that said, compliance is an essential part of your organization, and we are here to help you manage these efforts with increased efficiency, increased visibility, and ease, allowing you to be able to be confident in your compliance. Before we turn it over to Nicole, we'll be taking another quick poll.
All right, everybody. Why don't you tell us what your biggest challenge with managing your compliance is? On here we have preparing for audits, managing documents and tracking revisions, handling test and training records, reporting on tests, trainings, and other documentation, and managing internal processes. Please click all the ones that apply to your organization. We're going to take a quick poll for a couple of seconds, and then we'll move on to Nicole. Oh, wow, we have a lot coming in. We have all of them. Our head runner there is preparing for audits, and then managing documents and tracking revisions also seems to be a pretty big problem. We'll give it a couple more seconds and let everybody vote, and then we'll close the poll and move over to Nicole so she can talk to us a little bit about their Qualtrics system and their move from using paper and electronic files to Qualtrics. Fantastic. We are going to close the poll. I'll make sure we get those results. Looks like preparing for audits and managing documents and tracking revisions still are in the lead. We're going to flip over to Nicole. All right, Nichole Has Control. Why don't you tell us a little bit about your experiences, Nicole?
Okay, thank you, Sarah. So I work for the Rhode Island Department of Health Laboratories. And just to give you a little background about what our laboratory is, we have about 70 people working in our laboratory, and it's a combination of 3 sections. We have a clinical section, a forensic section, and an environmental section. And so before we came to Qualtrics, all of these sections were separate, and they were handling their, oops, there's Qualtrics. They were handling their document control a little differently. So the environmental and clinical sections were paper-based, and anyone who is paper-based realizes that this is very difficult, because when we have documents that need multiple levels of approval, what ends up happening is you have a printed copy that sits on 4 different people's desks for some amount of time, and it really is difficult to keep track of where things are. We had an electronic document control system for our forensic section, and it was all right, but there were a lot of limitations with it, and I don't remember too much about it except that there were templates for writing your SOPs and your procedures, so it wasn't Microsoft Office based. And this was something that we wanted to be able to have because most of our paper-based systems, all of those were written in Word. Our forms were done in Excel, and so we wanted to be able to just take those documents and dump them into one document control system. So what I'm showing right now is the way that we've organized our folders. So we have our clinical section here, our environmental section, food, which is a combination of clinical and environmental as far as personnel are concerned, and forensic laboratories. But we also have all of the things that apply to everyone in the lab and not just a certain section. So things like our safety manual, we wanted to put that in here so that everyone would have access to it, because before we had Qualtrics, the safety officer would have a copy of the manual, and some people would have PDFs on their computers. Keeping up with the revisions that people were getting was pretty much a nightmare, and it was very inconsistent. So this was one of the things that I really liked about Qualtrics, is that the documents that apply to the entire laboratory, everybody is notified when those documents are published. They can go and look at the document. They can access it any time that they want to. Another thing that I really loved was the fact that, and I'll show you one of our documents here, is that we could have headers and footers with macros in them that would automatically, let me move that out of the way, update our revision numbers, our published dates, and if we go down to the bottom, we can see we have our page numbers here, the document type, and we had pre-Qualtrics IDs. So if anyone came in and said, you know, they knew this particular document, this is a 504 document, they knew it by this code rather than by this name here, they could always type it into the search bar and they'd be able to find it very quickly. And so this was something that we didn't have this kind of consistency across the sections before we moved into Qualtrics. And we also didn't have the access. So we have one laboratory director that oversees the 3 sections, and she didn't have access to all of these documents just from her office. It would be an email out to a supervisor or something to send her PDFs, and this way it's just so much easier to find everything. Another thing that I particularly enjoyed, just because I think it looks fantastic, is that controlling our documents in Qualtrics allows us to have color. So when we're talking about how to use software and things like that, I think it's very helpful when people are reading instructions, especially for computers. I find it very hard to follow computer instructions on paper. I would rather someone just show me. But in color, it seems like it just looks so much better. And another thing, which I just absolutely love this instruction, so I'm just going to show it off. I'm not a microbiologist, but when I saw these work instructions come in, I was absolutely thrilled, because you actually get the full color of what the plates should look like, what results you would be expecting, and I think that for training purposes, this is extremely helpful, because this will, someone can sit down at Qualtrics and read through these procedures, and they're seeing things the way they would actually see it in the laboratory instead of a PDF or a printout that's been copied multiple times. So we liked that. And what we did is we've set most of our documents on a 1-year expiration. And what happens when a document expires is that document will immediately go into the document manager's inbox. And that reminds all of our supervisors to do their annual review. This was something that even if the supervisors were remembering to do it, we weren't necessarily capturing it on a paper-based system. But because Qualtrics allows you to update your document or verify that it's up to date, that information is captured. What I have found is that now when documents go into inboxes, rather than a supervisor looking at a paper copy, they tend to make more changes. They tend to want to fix it because it's already in edit mode and it's already in their inbox. So if I could find, let's see, okay, this was a good one. So we have, this is our 525 method. And if you wanted to see any of the revisions that were made, you can go into the properties of the document and you can see for each revision what was going on. So this was revision 1. We put it into Qualtrics. We hadn't made any changes from our paper-based system. Revision 2, we can see exactly what changes were made here. Revision 3, same thing. We've changed formatting, but we can be pretty specific about what changes we want to make. And I noticed that when it was paper-based, there would be a page that people include to say the changes that they had made, but when you're actually writing it out by hand, you're not including the kind of detail as if you were doing something like this, where you can take the section, copy it, paste it onto a blank Word file, change it in your document, and then copy your change, and then paste it right after. And so we would take all of this information and just throw it into the changes made, and then it holds on to it forever. So we like that it will do this, and I've found that supervisors actually spend more time looking at their documents and are willing to make more changes now that everything is digital. Because there were times where I know that people would look at documents and say, oh, I only need to change the grammar on this, but I'm not going to bother because it's already gone through 5 people. I'm not going to bring this document back and start that all over again. So we found that to be very helpful. And what we did, this is something that we've done a little differently than I think what it was intended for, but we've been using our testing modules in order to track attestations to documents. And so what we do, and I actually have an example here. So our chemical hygiene plan just came out, and this is the email that I received. Please log into Qualtrics and take the test for the chemical hygiene plan, which is not really a test, it's just an attestation. And here's the other email that Qualtrics automatically sends once it's published that says, these are the changes made. We updated the list of supervisors, changed MSDSs to SDSs throughout. And so we know what to look for. And so I would come over to my test, and I click on it, and it says, please read the associated document. Did you read and understand it? And do you agree to follow the procedures contained therein? And so then I would say yes, and I would just log in, and then it would capture that I did this attestation, which I really did read this document before I just clicked that. I don't just go and click things. But that document is done. And now if I want to see what tests I've taken, I can run a query and say, okay, well, let's look for me. And run the report. And so these are all the attestations that I've taken. And if you go to the most recent, this is the one that I just did. This was the chemical hygiene plan attestation. These reports are very customizable. So you can pretty much set the filters for what you feel like querying. So if I just wanted to see just me and the chemical hygiene plan, I can see that. If I wanted to see everyone for the chemical hygiene plan, I just click myself off, and I can see everybody. And this document, I think, it came out this morning, so these are all the people that still need to take the document attestation that came out this morning. And so that was very nice because we really had a hard time keeping up with, okay, a supervisor would have to go to everybody in their laboratory and say, okay, did you attest to this one? Did you attest to this one? I need to get your signature. And there was a lot of back and forth, whereas this, it reminds everybody by email. They log in, it's in their inbox, and they can just do it themselves. Okay, so let's look at workflows. We basically set up just the regular workflows. We did a corrective action, deviation from procedure, preventative action, submitting safety concerns. And what I found nice about this is we actually, for submitting safety concerns, we have a safety committee that meets probably about twice a year. And people would bring safety concerns that they've heard from the laboratory to that meeting. I mean, granted, if it was something very serious, we wouldn't hold on to it for 6 months for a meeting. But there were other things that it would be a little while before it got to the whole committee. Sometimes some committee members would talk about it without informing other members. We wouldn't have a meeting for a little while. So what we did is we created this workflow so that anyone in the building, if they have a safety concern, they can fill this out, submit to the safety committee, and then everyone in the safety committee gets it in an email, and we have the opportunity to make comments in a box similar to these, where we can say, oh, this is a safety concern, we should probably do this. We can have discussions back and forth, and then everyone can comment after they've seen their email when they have the time, instead of trying to coordinate an actual face-to-face meeting with every safety committee member. So that was pretty helpful. The other thing for auditing and compliance, which I absolutely love, is the tracking of corrective actions. Because I can show you a report. Okay. So if I had an auditor come in and I said, I wanted, the auditor says, I'd like to see all of the corrective actions that were done in the organics laboratory for this year. So I can just go down to one of my fields. I grab organic chemistry, and I do a search. And these are all of the corrective actions that they logged in organic chemistry. And so if you click the link on any of these, you see the full detail of what was happening, who it was routed to, when it came back, what the description of the nonconformance was, any remarks, what corrective actions were taking, root cause, things like that. So we can capture all that information pretty quickly, and I can scan and see exactly what was going on. Also, this list can be exported to Excel so that you can have a list, and it will tell you if there are any that are still open. These are all finished. We closed all of these out. But it really helps you to keep track of what's going on. And if I can show you, I can compare this to how I used to track my corrective actions. And this was what it was. And it was really hard for me to find anything. I have them all, but okay, well, the organic chemistry lab, there was something that happened with a sample, and we're not really sure of the date, so it would be me going to, okay, here are all the ones for organics, and I'd have to open up all of these documents and try and figure out which one it was. And this, if you're curious, this was how they used to look. So they were paper-based, and I would have to read through and find the ones that I was looking for. So Qualtrics definitely helped out a lot with all of that. This was just so much easier to be able to say, okay, I can just run a quick report, grab a list, and then everyone can see what's happening. Okay. And trainings. This is the last thing that I wanted to show you, because this is also something that we didn't necessarily use it, I'm sure, as it was intended, but it was very convenient for us. So what I did was, we were having some, it was sort of an issue where MDL studies that were due on a 6-month basis, sometimes we were forgetting, or we'd be off by a few months, and it was really hard to keep track of, because so many methods were once a year, and then there were other methods that were every 6 months. And so what I did was I set up trainings for MDLs. And so I've got a first half of the year, a second half of the year. And these trainings will go out automatically to the people that I've designated. So this would be Jeff, who is actually the one who would run these MDLs. So he gets this in his inbox, and it says the MDLs for chloride are due this month. Complete it and attach the MDL study summary to this training. And so what he would do is, okay, he gets this email and says, oh, yeah, that's right, they're due this month. He does the MDL, he attaches his summary, and then once he sends it, it will go to his supervisor and to me, and we both get a copy of that summary so we know that it's finished. So not only does this allow us to know, that it's been done, but this is also a report that we can run to make sure that the MDLs were finished. So if I wanted to check on all the chloride MDLs, these are the ones that he finished. So he did some in June of last year, and then he did November of last year. So we just started this last year. But we found that this was very helpful, and as the MDLs start building up, they'll just be in a nice long list, and we can just click on them individually. And if we click on the training, you see that the document, his SOP that he uses to do the MDL study is right there, and we can actually view the summary of the MDL. So it pops up here. These were his results, and this is his calculation. So all of this is now captured in Qualtrics instead of being on the supervisor's computer and then on in a folder on my desktop, and then he has his own. We can just have it here, and then all of these other copies don't need to be controlled. They don't need to stick around. And it's very easy to search them in Qualtrics. Okay, so unless anyone has any questions, I think I've pretty much gone through everything that I was thinking of talking about.
All right, Nicole, thank you so much. That was incredible. We do have a couple questions coming in, so for everyone that has questions, feel free to put them in that question box in the bottom of your little pop-up window over there for GoToWebinar, or in the chat box to ask those. But we do have a couple that have already come in. Someone says that your system is so well organized. Do you have any recommendations for best practices for a successful implementation and managing the system?
Oh, that is very nice. Thank you very much. I think the easiest way to go about it is to start small, because what I did during implementation was, instead of we didn't start with the health and safety manual, because that was something that would apply to everybody. And I wanted to train everyone in small groups and get them used to the system before we got the higher level documents in. So what I did is, once the system, we were set up to start using Qualtrics, I went through every month. I would take an individual laboratory. So the first month I took toxicology. The second month I took DNA. And I went through just their small group, 4 or 5 people, and we worked on their documents. We got them into their folder. We got them comfortable with using their own things, and we started that way. So we got all the documents in first. This also helps, too, if you put the little documents in first. It helps when you have your higher level documents, you can add hyperlinks to them to just go to other places. So if you have a policy manual or a QOP, and you are referencing another document that is also in Qualtrics, you can put the hyperlinks, and it will just bring you right to those documents. So let's see if I have. Okay, so in our document control section, we also have the document control using Qualtrics work instructions. So if anyone were looking at this, they could just click on that link and then go right to how we're using Qualtrics. So I think that starting with the very specific work instructions and then working backwards up the ladder kind of worked best for us.
Thanks, Nicole. We had a couple more come in, too. And one of the questions was, how do you work with proficiency test reviews?
Proficiency test reviews, what we did, and I set this up, oh, it kind of kicked me out here. For DNA, for FBI standards, QAS standards, they have to have a review of the proficiencies, and they have to have, each of our analysts has 2 proficiencies per year. And so what I did was I sent those out as trainings. And so I think I have I just have to figure out what I called it. Okay. So these were the 2 proficiency studies that I set up for them, the first half of the year and the second half. And so what they do is they'll get these. I think one goes out, so this goes out March 1st. I want to say the other one goes out probably October 1st. And they get this message in their email that says they have to upload the proficiency test review form to show that the proficiency test was completed for the first half of the year. So once the results from the PT come back, they go automatically to the supervisor. The supervisor reviews this form, documents her review on this form. I can show you the form. So this is the form that we use. So she documents her review. Everybody signs it. And then the analyst will take it. Oops. The analyst will take it back to her training module, and she'll upload that file. And so if you want to do a report, no, this is training. So let me grab one of my DNA people here. So Alex is in DNA. So if we run a report on Alex, so she did her first half proficiency in 2014. She did her second half in October, and her first half has been sent out, and it's currently in-house. So once she gets that, she'll be able to upload it. So this is the training ID. This isn't a link, but we can type in if we wanted to see. So 5001. Oops. So you see that form that we filled out and signed. And this is what we're keeping in Qualtrics so that we can go back and check them out.
Great. We had a couple more questions come in. We had somebody ask, how did you determine who would be the super users and frequent users of the product to then consider licensing?
We had some meetings about it. We sat down with the chiefs, the director, and the QA officers, and we sat down to talk about who would be needing the most access. And we ended up giving the first round of dedicated licenses that we got went to all of the big approvers. So all of both QA officers, myself and Melissa Martin, who is the QA officer of the clinical section, we would absolutely get dedicated licenses. And the chiefs of the section would also get dedicated licenses, particularly at the beginning, because everything as soon as it was going in was needing approval. Once they were all in, we could ease off a bit, but right at the beginning, we definitely needed those people to have licenses. And for the supervisors, we gave them first to the sections that were ISO, and those were that was the forensic section. So those supervisors got the dedicated licenses, and they got their training first. However, once everything was in, because those dedicated licenses can be switched back and forth, if I knew there were certain people that would be working with me on getting their documents in a particular month, then I would switch them to a dedicated license and take it away from someone whose documents were already in.
Great. Looks like we have another question in there, too. Can you use electronic signatures to sign documents?
I'm not sure about that. We've actually just been using the digital signatures because you have to log in to approve things, and we've had it so that you have to log in and use your user ID and password to be able to submit a training or to submit a test. So any of those attestations or any of those PTs or anything, scientific literature reviews, things like that that I sent out as trainings, the user has to log in with their username and password to be able to document those.
Cool. Well, that's perfect, and I'll throw it over to Julie, and I think she has something to add to that, too.
Yeah, definitely. So yeah, with either proficiency testing or any other part in the system, we do have electronic signatures that can be turned on. So in addition to them being logged in, you can have them re-enter their username and password, and then there's a little disclaimer that states, that their signature is binding by electronically signing this document. So that can be turned on or turned off throughout the entire product.
And we did have a follow-up to that asking if the digital signature was acceptable to your regulatory inspectors.
So far, it has been. We've had, I believe, one mini surveillance and one full accreditation since we've been on Qualtrics for the forensic section. And we should be going for our second full accreditation next spring, and we're also trying to get our food section ISO accredited. So far it hasn't been a problem.
Mm-hmm. And we've heard similar things from other customers as well, that satisfies that requirement. And we have several of our customers who are under the, excuse me, 21 CFR Part 11 compliance with the FDA, and that electronic signature has satisfied that requirement.
Fantastic. I think we have one last question, and if anybody wants to submit anything else, go ahead and get your last question in. But we'll go ahead and ask you this one for Nicole and maybe for Julianne. We have some questions around security and edit and view permissions on documents. So how did you determine who would approve a document, and then how do you manage the view and edit permissions on those documents?
What we did is, because we set up all of the laboratories individually, so if you look at the screen here, so environmental sciences has air pollution, organic chemistry, water chemistry, and micro, and rabies testing, which is a part of micro. What we did is, when we set up the folders, we made sure that for this folder, the approval is set so that, let me see if I can do the folder properties. And I think the document lists. Okay, so this is the list that filters down to all of the documents that are in this air pollution folder. So we have our supervisor, which is an approver and a reviewer. The chief is an approver, and the QA officer is an approver. And all of the staff in air pollution get notified when there are new documents that pop up. And if you go to the security, we set it up so that all users and visitors can see these documents. So if you're not logged in, you can still look at these documents as long as you go to the website. All the users can look at, when they're logged in. The only people that can edit these documents are the chief, the QA officer, and people directly in air pollution. So someone in DNA or in toxicology would not be able to put any of these documents into edit. So we set it up on a lab-by-lab basis. And that's usually how it was. Supervisor, QA officer, and chief sign off on everything. But anyone in the lab can start revisions, because usually it's the analysts that will realize when something's being done a little differently from what they're reading in the SOP. And they're the ones that we like to have review a lot of the documents, because they're the ones working with it every day. Whereas the supervisors aren't necessarily following that SOP, so they might not know where, oh, you used to put this, evaporate this down to 1 mil, and now you're evaporating down to 1/2 mil, but the supervisor didn't know, and they've just been doing it. So we've set it up that way. And then the higher level documents we've left in the hands of the chiefs and the QA officers. So like the policy manuals and the QOPs.
Thank you so much, Nicole. I think we're going to flip back to Julianne for a minute before we close out today. I'm going to switch over to Julianne. If you all have any additional questions about Qualtrics or compliance, or if you want any more information about, anything that we've talked about today, feel free to contact Julianne at jpoff@qualtrics.com or go on to qualtrics.com. Also, feel free, we're on Facebook, Twitter, and LinkedIn, so if you want to follow us or like us on any of those places, keep up with industry news and what's going on within Qualtrics and our company. Thank you so much for attending today's workshop. We'll be sending out the recording a little bit later today or tomorrow, so you can rewatch it if you'd like, or you can share it with some of your coworkers or friends or other individuals in quality. And thank you again to Nicole for doing such a great job and for showing us her very beautiful system today. Hope you guys have a great rest of your day. Thanks.
Thanks, Sarah.